Welcome to the Body Shop Physical Therapy. My name is Catherine Price. I'm a physical therapist. I'm going to go over the Egoscue Method for chronic knee pain related to bow-legged positioning or varus deformity. Before I begin, I'm going to speak a word of life from Romans 12:2. And do not be conformed to this world, but be transformed by the renewing of your mind, that you may prove what is that good and acceptable and perfect will of God. So this is going to be the menu of postural exercises to address chronic knee pain, and again, it is going to be related to the positioning of the femur in external rotation. So you're going to have a externally rotated femur that gives you a varus deformity, also known as bow-legged positioning. So if you have bow legs, this is going to probably be of benefit for you, and especially if there is knee pain related to your positioning. And what happens in that varus deformity is you wear the inside of the knee down. So if you work on realigning the leg so that the joint will move more uniformly, you can prevent some of the breakdown in the knee that leads to arthritic changes over time. So I'm going to use a timer. I can use a pillow or a block. I'm going to use a block. I have an ottoman. I'm going to use 2 chairs, and then I have a step stool that I'm going to use for a ladder. And I'll talk you through this. I'm going to take you right through this menu from start to finish. The first one is going to be flexion knee pillow squeeze, and you can use a pillow, but I am going to use a block for this and a regular chair. So I am going to sit in on the edge of the chair. I want my toes facing forward. I'm going to place the block between my knees. I'm going to pull my shoulder blades down and back, and then I'm going to squeeze my knees in and relax, and I'll do 3 sets of 10. So beginning with the first set, squeeze and relax. 2, relax. 3, relax. 4, relax. 5, relax. 6, relax. 7, relax. 8, relax. 9, relax. And 10. Taking a deep breath in. I'm going to do another set. Toes are facing forward, shoulder blades are down and back, arms are relaxed, abdominals are relaxed, squeezing the knees in. 1, relax. 2, relax. 3, relax. 4, relax. 5, relax. 6, relax. 7, relax. 8, relax. 9, relax. And 10, relax. Take a deep breath in. Facing forward, my toes are facing forward, the block is between my knees. And my last set of 10, I'm just going to squeeze, relax. 2, relax. 3, relax. 4, relax. 5, relax. 6, relax. 7, relax. 8, relax. 9, relax. And 10, relax. So that is 3 sets of 10 of the squeezes. Then I'm going to do static back. What I'm gonna do for this, you can use a chair. I'm going to bring my buttocks as close to this ottoman as I can, and I'm gonna get into a 90-90 position. The knees are at 90 degrees, the hips are at 90 degrees, and I wanna set my timer for 5 minutes on this one. So I started my timer. My arms, my palms are going to be facing up towards the ceiling. I want them about 45 degrees from the body. And then I just want to allow my low back to come to a rest on the floor. You may feel that your back is arched. And over time, as the muscles relax in the back, your back should start to come closer and closer to the floor. You do not want to contract the abdominals to force the back down. You just want it to come down naturally. This is where I like to work on diaphragmatic breathing, which is breathing from the diaphragm. So there's a muscle at the bottom of the rib cage, and you want to expand the ribs, not just up but out. And I'm going to take a breath in and then exhale slowly. Breathing in from the bottom of the rib cage. And exhaling slowly. And breathing in. And exhaling. And breathing in. And breathing in. And this should be a comfortable position to get into and stay. With the knees and the hips bent at 90 degrees, it takes the stress off the low back. The muscles that attach from the pelvis into the back are relaxed, so it allows for a proper alignment in the pelvis and low back, and that is going to help with lower extremity alignment. So taking a breath in, all the way out. Two minutes to go, working on the diaphragmatic breathing. About 30 seconds to go. Deep breath in. And exhale. That is 5 minutes. The next exercise is cats and dogs. So I want to go onto all fours. My knees are going to be underneath my hips. My hands are going to be underneath my shoulders. I'm going to go through 10 smooth movements. I'm going to round my back, dropping my head, and then I'm going to lower my back, arch my back, and look up. That's 1, rounding and looking up. 2, rounding, looking up. 3, 6, 7, 8, 9, last one, and 10. That is cats and dogs. Then I'm going to go into static extension. I'm going to use the ottoman and set my timer for 2 minutes. This is a 2-minute hold. And I want to comfortably come up onto my knees and walk my hands down to the floor. I want my hips to go about 6 to 8 inches in front of my knees. My butt is going to tilt towards the ceiling. My shoulders are going to drop. My shoulder blades are going to come close to my spine. And then I want to just relax my head and neck down and just holding this position. And you want your knees to be on a soft surface. You want it to be comfortable to the knees. Again, I'm shifting my hips 6 to 8 inches in front of the knee. I'm going to let my shoulder blades drop to the spine. So here I've got them away from the spine. Here my shoulder blades are close to the spine. I'm going to let my head, neck relax and then hold this position. And this is from 1 to 2 minutes. So it takes some time to build up the strength to hold, especially in the arms. So you can start with 1 minute and build up to 2 minutes and just hold this position. And while you're here, just work on taking nice deep breaths. That is going to be 2 minutes. Then I'm going to do a standing quad stretch for a minute. And so I'm going to use 2 chairs for this. What I want to do is prop one leg. So I'm going to prop my right foot, the top of the foot. It's going to be pointed. I'm going to prop that on this chair, and then I'm going to use the other one for balance. My leg that is my standing leg, which is my left leg, I'm going to tighten that thigh, and I want my knee to be in line with the other leg. So I've got my left thigh tight, my toe is pointing straight ahead, and I'm bringing that right leg behind me with my toe pointed, and just holding this for 1 minute. Now, the higher you bring your foot, the more of the stretch you're going to get. So you want to get in a position where you can keep this posture and get a stretch through the front of the leg. And you want to make sure that you're standing up tall so that you're not leaning forward or not allowing the body to stay in alignment from shoulder, hip, knee, and ankle. So if you have to lean forward, then reposition the legs so that you can stay upright. I've got my thigh tightened on the left side, my foot's rested on the right. I'm getting a stretch through the front of the leg and holding this position. 5, 4, 3, 2, 1. That's a minute. So then I'm just going to turn around and do the same thing the other direction. I want to tighten, keep my toes facing forward on that right leg. I'm going to tighten the right thigh. I want to keep my hip in line with my shoulder, so I don't want to be leaning forward. I want to stand upright and hold this for 1 minute. So I'm setting my timer and holding here, tightening the thigh on the standing leg. My toe is pointed on the leg that's being stretched, taking deep breaths in, all the way out. And it takes focus to keep the thigh tightened on the straightened leg. So don't let that thigh go. Keep the thigh tight. Deep breath in. Halfway there. Getting a nice stretch on the leg with the foot up and resting. And you can bring it and rest it as high as you comfortably can, but still maintaining this posture. Deep breath in. And that is a minute. The next one is going to be a standing forward lean. And to do this, I am going to, and we want to do this one for 1 minute. I want my toes facing forward. I want to keep my thighs tight, and my feet are going to be hip width apart. So the standing forward lean. Then I'm going to take my hands, rest them on my low back and my upper buttocks. I'm going to keep my thighs tight, and then I am going to slightly arch my back. I don't want to stick my butt out. Once I have arched my back, so I'm going to get that nice curve in my low back, and then I'm going to lean forward at my hip. I don't want to stick the butt out, so I don't want to go back here. I want to lean forward at the hip so that the hip stays in line with the knee and the knee in line with the ankle, and then I want to take my elbows and I want to squeeze my elbows together. Once I get into that alignment, I want to hold this for a minute. So I am standing up tall, tightening my thighs, getting an arch in my low back, and then leaning forward at the hips, and then squeeze the elbows together and hold this for 1 minute. So keeping the thighs tight, squeezing the elbows together, and hold for 1 minute, taking nice deep breaths in. You want the knee to stay in line with the hip. Tighten the thighs. Don't let the thighs go. Squeeze the elbows together. Deep breath in. 15 seconds to go. 5, 4, 3, 2, 1. And relax. Then I'm going to go back into cats and dogs. Same thing. Hands underneath the shoulders, knees underneath the hips, going through those 10 smooth movements. So rounding the back 1, dropping the back down, looking up, and rounding it again 2, and looking up, 3, 4, 5, 6, 7, 8, 9, last one, 10, and looking up. Then the last exercise is going to be progressive supine groin. So I'm going to use a chair and I'm going to use a step stool for my ladder. And this is going to take 18 minutes. It's the longest one. What I want to do is rest my leg in a 90-90 position, and the opposite foot, the heel, is going to be rested on the top step for 3 minutes. I want to hold this. My arms are going to be 45 degrees from my body and just resting right here, taking deep breaths in and all the way out. This is going to allow the hip flexor to slowly relax, and you do not want to force the back down, but let the low back rest down into the floor as you hold this position. And you can hold up to 5 minutes if you feel the back needs longer to rest down to the floor. But 3 minutes is what we're going to do at 3 different levels on the ladder. Taking a nice deep breath in. So almost halfway there. This is going to be the longest one out of the postural exercises. And you don't want the foot with the leg extended or straight. You don't want the foot to be turned in or out. You want the toe to be pulled back towards you slightly in neutral position and straight up, or at least in line with the body, not turning in or turning out. So that's 3 minutes at the top position. I'm gonna bring the ladder away just enough so that I can rest my heel on the next and repeat 3 more minutes here, and allowing the low back just to rest down to the floor, but not forcing it with the abdominals. So just resting this in this position, not allowing the leg to turn in or out. Taking deep breaths in, using your diaphragmatic breathing, breathing from the diaphragm. seconds to go. Keeping the hips relaxed. And then I'm going to bring my leg down to the floor and just hold that in that lower position. So I'm going to stay on my back, the foot is on the floor, same positioning, the arms are 45 degrees out from the body. Don't let the leg turn in or out. Holding the foot in a neutral position, and then just breathing in and out using the diaphragm. Almost 30 seconds left. And that completes the 9 minutes on the left leg. And then I'm just going to switch and do the same thing on the other side. So I'm going to bring the ladder and my left leg is going to be over this time. And then my right leg is going to extend and rest on the ladder. And starting here, arms 45 degrees away from the body, and just holding this position for 3 minutes. And just check in to see if you've got your leg that is over the chair, over the ottoman, that it is in a 90-90 position. Nice deep breath in and slow exhale. if you feel your shoulders start to rise up towards your ears when you're breathing in, focus on bringing those shoulders down as you pull the breath in. Seconds to go. If you don't have a ladder, you can stack some books and then just lower the leg down incrementally, about 5 to 8 inches. You can do as many different levels as you would like. I do 3 different levels. So I'm gonna bring this chair closer here, and I just wanna rest my heel on the next level, holding that in a neutral position. And same position, taking breaths in and all the way out. Minute to go, and then just one more position, and that completes the supine progressive groin. And the last one, I'm just going to move the ladder and allow the foot to come down onto the floor, and the foot in a neutral position, and just holding this position. Last exercise, palms are facing up towards the ceiling, taking deep breaths in. Letting the low back relax down into the floor without forcing it, Keep the abdominals relaxed. About 1 minute to go. Ten seconds. All right. And that completes the menu of exercises for chronic knee pain related to bow-legged position of the legs. I hope this is of help and have a blessed day.